This building in Sarasota, Florida, sunny Sarasota, Florida, may be the best kept secret in all of medicine. Wait till you see the programs in alternative medical care that are available here. Come with me, let me show you. And this is where the magic happens. We're in the lobby. This is where you'd come to get registered. And this is Luba. If you can hand me the registration form.
Oh, there you go.
We got to have a lot of information. So to get that all filled out, and you have your session with Dr. Monholland, which can last, what, an hour or more?
Yeah, an hour, 90 minutes.
Okay, an hour, 90 minutes, so there's a lot of questions, and it's comprehensive. Let me share with you what I think is an exciting feature of the practice here is that they collect patient testimonials. And what's really cool, check this out. I mean, handwritten. People say, well, this is just anecdotal. This is just anecdotal evidence. Well, if I'm going to go somewhere and I want to be treated effectively, I want to know that somebody did it before me. Most of us have heard about hyperbaric oxygen chambers. Well, we have that here as well. Cancer does not do well in a highly oxygenated environment, according to the doctor. So let me take you in here and show you what a hyperbaric chamber looks like. There is actually a patient inside. We're not going to show the patient, but this is the chamber. And they just climb in. After an hour, they release you. Hyperbaric chamber.
I've been in practice for 30 years. However, I started before that in biology, anthropology, medical anthropology, lots of field work and investigational studies with plants, with the Native American people and with the indigenous people in the Amazon, which I still do, by the way. I still go to the Amazon. I was just there a few months ago with the Shipibo Indians.
Really?
Yes, I was.
How often do you go?
I go at least once a year. I began with a connection to try to understand what we might be missing in modern society in terms of the ecological events of our time. We're working on what's the interface between the environment and our health. So all chronic disease patients, cancer patients in particular, where my main emphasis is the Lyme disease patients, chronic Epstein-Barr disease, the chronic fatigues, the fibromyalgias, also the influence of infections, chronic infections on the nervous system, so the neurodegenerative disorders, and of course because I have a background in boosting immunity, then all cancer patients, all Alzheimer's patients, all aging.
Integrative dentistry is the newest study of dentistry. It approaches dentistry from many different directions. It's on the cutting edge right now. It includes things like biological dentistry, where we study DNA of infections. We look at the bacteria in gums and under a microscope. It includes toxicological dentistry. We make sure the materials are safe, whether it be materials to make a partial. We try to avoid metals for the most part, cobalt and sometimes mercury. One of the things we also do is we look at allergies. And allergies are important. A lot of people are reactive to dental materials. And I try to work with as many people as I can and learn as much as I can, because this is a lot of new information coming out every day.
Dr. Dick Chapman, thank you very much. I see you've got patients out in the hallway jumping from foot to foot. Thank you very much for meeting with us.
Enjoyed talking with you.
OnDemand is a German engineered technology of a biofeedback machine, and it uses wave impulses. Onda is actually Latin for wave. It's neurological stimulation for pain and circulation. It promotes relaxation.
We're glad you're here, and if our patients are facing chronic pain, this is part of our protocol.
Yes.
Okay?
Yes.
Thank you very much.
You're welcome.
You know how people should move.
I do know how people should move. I had about 10 years of professionally dancing. When you're performing as a dancer, you have a wonderful conversation, a non-verbal conversation with your audience. And every audience is different. So you become very skilled at experiencing people's and audiences' energetics. And so then when I moved into movement, following my dance career, I brought everything that I had learned and experienced as a ballet dancer. I actually have 2 patents.
Okay, what are they?
The first patent is a method of mind-body movement for physical skills training. As a movement analyst, I study several systems of movement analysis and documentation. And then I synthesize them together to create a language for movement, which is what actionomics is.
Everything that you've seen on this video so far and everything that you will see is a brainchild of one physician, Dr. John Munholland. So tell us a little bit about, you've been board certified in family practice for how long? And
I graduated from medical school in 2000, so that's 14 years. I did 4 years of residency, and so I've been board certified for 10 years.
okay. You got interested in this as a child. How old were you when you decided, I'm not going to eat sugar?
12 years old.
That is unbelievable.
My dad brought home a magazine with this article that you guys have to read this. It's unbelievable what sugar does to you. So I read it, because my intention was to be a wise person. So sugar had to go.
If you'll explain this machine, and how does it work and what does it do?
Okay, this is ultraviolet blood irradiation, and actually it's pretty low tech. And by the way, I think that low tech is often the best medicine. It's a very simple technique. We draw blood out of the body, and then the blood drips back into your body over 45 minutes to an hour. And as it drips in, it's passing by these ultraviolet lights. So the blood goes through there. Ultraviolet A is shining from the top, ultraviolet C is shining from the bottom, and it goes through a crystal cuvette that flattens out the blood. So there's better exposure as opposed
More
to
surface area.
around 2, right.
Maybe you could explain a couple of the intravenous protocols that you use and what they do.
Okay. We do a large variety of IVs. The most popular, I think, is the Myers cocktail. And this is a combination of high dose vitamin C, high dose of magnesium, along with the B complex vitamins. We also do chelation therapy. This would be EDTA. And the value of this is it dissolves the plaque out of your arteries, so it improves blood flow. So if someone were told they have heart disease, this would be a good place to start. Doing the chelation, you're treating all of your arteries. Your 75,000 miles of arteries in your body, it's all being treated, as opposed to the bypass surgeries where they're just treating a couple inches of artery. It just makes sense that you would try this first, and maybe this is all you need. But even if you end up doing something more invasive later, this would be something to do in conjunction with that.
I'm a strong believer in integrative medicine, where we're combining conventional medicine with alternative medicine, blending it together so that we have whatever works the best for the patient. Particularly when it comes to cancer, I think this is really important. Step one is we all should be thinking about being on the anti-cancer diet, whether we have cancer or not. I think we're headed to a point in time we're going to be working together, and oncologists will probably be doing in their office a lot of what we're doing here. But when it comes to cancer, I believe you have to have your immune system engaged fighting the cancers, because your immune system is really set up to do that. You have cells specifically designed to look for cells that are becoming cancerous so they can be eliminated. Sugar feeds cancer. That's the whole metabolic basis of cancer. It metabolizes sugar and not oxygen, and so I believe that's step number one, is get the sugar out of the person's diet. We support the immune system basically 2 ways. One is detoxify the body and nourish the body. So almost everything we do here can fit into one or both of those categories. A healthy person should come to Sarasota, stay with us, and we can teach you the diet, serve you the diet, learn a lifestyle for maintaining your health, and then just come to see us once a year. So if you want your vacation to boost you up and extend your productive years, do a medical rejuvenation vacation.
His name is Dr. John Monholland, and he is here in Sarasota, ready to take your calls, ready to talk with you about better health. My name's Rick Hill for the Florida Integrative Medical Center. Thanks for watching.